can the device company extrapolate information from the data to determine how they configure their sets in the field? And to give you an example of how big of a problem this is, I know from personal research that 4 of the largest 5 orthopedic manufacturers had over $200 million in write-off of excess and obsolete inventory in the last year. And this is a yearly type of write-off that goes on.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
This week on Power Supply, we speak with Keerthi Kanubaddi, CEO of ReadySet Surgical. During his 12-year career as a surgical device and sales representative, Keerthi saw the need for software that connects hospitals with surgical device companies to help each entity oversee vendor-managed inventory. In the most severe instances, he saw the proper tools for a neurosurgery on a 3-month-old that were not available at the time of the procedure due to a lack of communication between the hospital and the surgical device company. As a result, the surgical team had to perform a different, more invasive type of surgery on the infant that resulted in a longer hospital stay and higher surgical cost. Disgusted because of the situation, Cannabotti designed the ReadySet Surgical software, quit his job, and made the technology available for hospitals to try out in 2014. So flash forward 7 years, and Keerthi is joining Hayes and I on this episode coming up. And I'm really excited to talk about this untapped potential because as technologies emerge, Hayes, I think we're getting better data, a better understanding, and what is really unique about this particular technology is the way that it ties the suppliers or the vendors directly with the hospital. It's almost like they're sitting on the same side of the table with the data, looking for ways to create efficiencies. And as we get into it with this interview with Keerthi, he's going to give us some numbers to really substantiate what the benefits of that will be like.
Absolutely. Come along and listen because he absolutely brings a ton of different facts and figures together. And to your point, their solution ties to the manufacturer, the hospital, central sterile, everybody into one piece, and it's fantastic. So hope you enjoy it.
All right, I'm Justin Pullen. Joining me today for this interview, Hayes Waldrop and Gary Skinner. We're going to be right back with Keerthi Kanubaddi.
From 17 Studios, you're listening to Power Supply.
Joining us now is Keerthi Kanubaddi, CEO of ReadySet Surgical. And Keerthi, I've actually known you for quite a while, and I've known about your solution, and a former colleague of mine works in your organization as well. So I want to congratulate you on all the success that you've been having, and really excited to talk about the hidden costs of implants. And I feel like especially now with tightening budgets, what an area for healthcare systems across the country to truly place a focus on an area that needs a good deal of improvement. So before we get into all of that, why don't you just introduce yourself to the audience and give them a little bit about your background?
Absolutely, Justin. Thank you for having me. My name's Keerthi Kanubaddi. I am the founder and CEO of ReadySet Surgical. Prior to starting this company, I spent a number of years as a medical device rep and actually carried the bag and saw many instances where our vendor inventory and the workflow that we in some cases interrupted, really had some big trickle-down effects for the hospital staff in sterile processing, in the OR, and even in supply chain. So that was the impetus for the creation of ReadySet Surgical, and I'm really happy to join you all today to just talk about some of the costs that we uncover through our technology that really aren't always clear to the stakeholders.
And, I like to put this under a large category, vendor managed inventory. I actually think I got that terminology from you in some of our early conversations several years ago, Keerthi. So is it just implants, or what does vendor managed inventory mean? What's it encompass?
Great question. Vendor managed inventory really is an all-encompassing term. It includes implants. It includes loaner trays, consignment trays and implants. Even some capital equipment can be managed by the vendor. But really the fundamental theme is that the vendor, in many cases, owns the inventory until it's actually used or implanted in a patient. And they also take on the responsibility of making sure that it's ready and prepared for surgical use. So vendor managed inventory, really big term, but really includes all of the loaners, the consignments, the implants, and even in some cases, the durable medical equipment and capital equipment.
So Gary, in his experience, has seen this from multiple different angles. So I know he's going to be chiming in a decent amount during this interview. But I know historically there's been a lot of challenges, and you're alluding to a lot of them. But I thought, Gary, maybe you could tell us, just from that vendor perspective, what some of the challenges that you ran into. And then, Keerthi, you can really piggyback off of that and talk about the challenges for supply chain and the vendor companies themselves as well. But Gary, what was it like for you as a rep, and how much did you know, boy, this has got to be a better way to do this?
I'm very excited to hear what Keerthi has to say, because definitely there was some struggles and better systems out there that handled it. And then obviously Keerthi has talked about opportunities to make ReadySet Surgical an advantage to help with what we saw. But one of the things that I always struggled with was, how do you ensure that the pass-through, once it gets to the doc, once it gets handed off to SPD, once it gets handed off to the OR, once it gets used in this in the case, and then gets to the circulator and the implants. But I mean, just that whole process flow, especially of a new hospital system when you're going in, how do you validate? How do you make sure that you know that your set's getting to the right people? There seems to be so many different accountabilities, from supply chain to surgery to the right implants being used and the right payments and the invoices done. So just help me walk through that just a little bit, Keerthi, if you wouldn't mind.
I'll piggyback that a little bit. Back in the day, I carried the bag as well. And probably the better term was I carried a lot of trays, a lot of implants and bins full of implants and instruments. Are we talking mainly just implants here, or instruments as well with what you guys do?
So ReadySet, in our world, we tag anything that is coming in. So not only the individual implants themselves can be tagged in ReadySet, totes of implants can be tagged, instrument trays can be tagged, individual instruments can be tagged, and consignments as well. So there really is, within our purview, this entire area of vendor managed inventory that can be tagged and tracked within ReadySet. And, I think, as Gary was alluding to, that process in today's world has so many touch points, has so many stakeholders, and we found that there is a lot of duplicative communication as a result of that. So for us, the fundamental design consideration, really, there are two fundamental design considerations. Number one, as much of the workflow that can stay without being disrupted by the staff, meaning the systems that they're currently using today, a technology really should pull data from those systems as opposed to asking a clinical person to change their workflow to enter data. So that's one of the key design considerations. Secondarily, for us, it's about proactivity and starting the process earlier. So what ReadySet does is notify vendors of upcoming cases as soon as they hit the surgical schedule. And that earlier notification allows everybody to be on the same page through a transparent communication platform, essentially, that allows everybody to understand what is needed for the patient. Is that inventory that's needed for the patient actually contracted at the hospital? When is that inventory arriving on site? Is it meeting our requirements from just our general policies? Is it being sterilized properly? And finally, is it being billed appropriately? And is it matching what was put into the implant log? That is kind of the end-to-end of what ReadySet is able to deliver.
That's a phenomenal thing because, as I mentioned, many years ago when I did work in the orthopedic industry, one of our primary concerns and problems was you would bring in a whole set of knees or hips or what have you. And so many times when you went to pick them back up, you're missing more implants than were used. And that delta is very expensive. And it was hard to negotiate with the hospital when you said, hey, I brought 30 implants and they're not all here. So I'm sure that's what you can address there, right?
Absolutely. And, I think that it's important to note that accountability is a two-way street. And if vendors are doing what they're supposed to do in the ReadySet platform, they are able to capture images at the point of delivery. So when those items go missing and there is a time-stamped image at the point of delivery, there's a very clear rationale for a vendor to be able to request a reimbursement for that item. But if the vendor is not following protocol and consistently brings inventory in that's either not approved or is not being removed in a timely fashion, those are individuals that really shouldn't be protected in terms of instrument loss because they are putting a stress on the hospital system.
Absolutely. They're dishonest too, in many cases. I'll just be frank. I know it happened. So
it does, but laundry is also a big culprit. What I've learned over the years is that many of the items that have gone missing actually are things that maybe were wrapped up in drapes in the room, or they could have been in the decon process. When they're going through a washer, small screws can be blown out of the caddies. So I think there are a lot of instances where it is truly just an honest mistake, but it's important to have a chain of custody around those things and not allow vendors to just haphazardly submit implant loss charges.
Yeah, chain of custody we've had that term pop up a ton on this podcast already. And last time we were having a conversation around logistics and the impact that the pandemic had on chain of custody because of social distancing. And so even just with regular deliveries, there was this separation and this challenge. And when you talk about controlled substances and pharmaceuticals, how do you get them signed for in the early days? It's just been very interesting talking about how you move through that. And it really all comes down to accountability, right, Keerthi? I mean, it's having a clear sense of accountability because when you start getting mired in those difficult gray area conversations and trying to tease that out, isn't there a major soft cost to that for an organization?
Yeah, I think you're really hitting on something that, we understand soft costs are never enough to justify a product on its own, and we certainly have hard ROI to show. But that is such a critical aspect to just have that ability and confirmation that the data is being captured and that there is a source of truth. And I think that's ultimately what drives the accountability. The fact that there is a place where you can go. You can determine when was this vendor invited to the case? When were they notified? When did they respond? When did they deliver? What were the characteristics around that service instance? Did the vendor do a good job according to the hospital's policies? And we also believe that being able to report back in a very granular way about the service level differences between vendors is really important to, because it's more than cost. It's about how well is this patient being taken care of.
So, the other thing is there's a lot of industry trends going on in regards to vendor managed inventory in general. And so previously you would see a good majority of this being done in the hospital, but a lot more is getting moved to ambulatory surgery centers, and that's really changing the game. And I wonder how much, when you start talking about all that variation, it's one thing when it's just one, I'll say, surgical business unit, right? And then maybe you have 10 of those or 12 of those across a small to mid-sized business that you have to manage. But when you start talking about ambulatory surgery centers, now there's so many more touch points, and maybe with smaller volumes at the ASCs in the past, that wasn't so much. But with the volumes increasing and the number of procedures, do you see a movement towards this kind of a technology in that ASC or subacute level of care versus, acute care and overnight stays?
I would say the one common theme, regardless of surgical setting, is going to be the need for transparency and accountability, and the need for people to anticipate what that patient is going to need and what is eventually going to be billed to their insurance. So that exists in both the hospital and the surgery center market. There are certainly different characteristics. We have found surgery centers to have a smaller amount of vendors that they work with, and in many cases, procedurally, they are very consistent. So they become a very well-oiled machine in terms of on-time delivery, having products on the shelf, and being prepared. But what still is lacking is this coordination between the surgery center and that vendor's warehouse. And that is something that ReadySet really does, is to connect the location or the surgical site to the actual vendor and the vendor's warehouse that is supporting that surgical site. So we have seen that even the surgery center is one where billing reconciliation, anticipating what is going to be needed for the patient, those are all very real considerations that where ReadySet is currently used in surgery centers today to deal with those issues.
But aren't we seeing a lot more total hips and knees and total joints moving towards surgery centers for 23-hour stays? Are you seeing a lot more of that?
We are. And, I think, Hayes, you bring up the point that a lot of people have been watching for a while, the trend of these total procedures and the reimbursement landscape around those. So we are seeing that trend. What we found is the more active patients, those patients that can be there for 23 hours or less, are generally the ones that are being done in surgery centers. So it is, there's still going to be a contingent that always has to go to the hospital because of comorbidities. But yes, we're seeing a pretty large shift, especially in those health systems that are making a concerted effort in what may be a procedural area, and they want to move those procedures to the surgery center. So we are seeing the shift.
Yeah, I was just curious for you to expand a little bit more on the ambulatory surgery center, that call point and that movement, whereas a lot of those surgeons are obviously sharing sometimes at the hospital, to your point, the comorbidities, and also at the ASC. Are you seeing a different shift of what the call point at the hospital versus the call point at the ASC to move those sets there? Can you speak to that a little bit differently?
Yeah, absolutely. What we found in the hospital is that there is really a cross-functional team that is primarily involved in the interaction with the vendor, whether it be the notification of the upcoming case or the sterilization of that inventory, or even just the text messages and phone calls that are going back and forth to ensure that everything is ready for a given procedure. But in a surgery center, we're finding that group to be much smaller, meaning those individuals that manage materials and the end users, meaning the surgeons themselves, seem to be important stakeholders in our surgery center conversations. And, they're very open to this message because they're looking to optimize and be as efficient as possible in that environment. And I think that's their original goal in moving the cases to that environment. So if we can make the case that much more efficient by ensuring that you don't have extraneous inventory, or you're not being billed for off-contract items, or even the items that you're being billed for have been vetted from an insurance perspective before the patient is even at the hospital. All of those things, I think, are relevant. It's a smaller group, but they're relevant to the ASC, and we're seeing those call points also be a smaller group, usually a materials management or a business manager at the surgery center. And then usually the surgeons that are involved in some leadership role within that surgery center.
I almost wonder, too, how consolidated service centers can play a role in all of this, too, because it really does change the whole logistics game. Maybe we save that for another conversation, but I can see where your technology and just this movement to ASCs can make those CSCs even more valuable.
Well, no, I would just say that I think that model actually is really well aligned with what ReadySet does, because it allows for a remote management of inventory. So it gives really full control to a vendor and their colleagues and even the staff to be able to look at real-time status, assign trays to cases, assign implants to cases, and manage that entire process so that outsourced sterilization center is a great application for ReadySet, mainly because it is becoming more complex to serve that procedure, not less complex, because they're in some cases taking it to a totally different location that is then being sterilized and shipped to the final surgical site.
So another movement we've seen is increased customization of trays. And all you ever hear in this industry is standardize, standardize, standardize. And then yet in this area, because innovation is so much driven in that vendor managed inventory, we just continue to see more and more customization. So is this something that you have to have a technology for? Does technology help you still find ways to standardize even in the midst of customization that's necessary to drive the industry forward?
My understanding, or at least my kind of perception of the customization that we're seeing, is actually it's not a one-off type of activity. And what I mean by that is we engage with a lot of large medical device manufacturers who seek our data about what is being used in the operating room. And they're also gathering it from their field representatives. But what we are seeing is they're using it as a larger initiative to try and get to a best setup or most commonly used setup based on maybe some procedural considerations, but for the most part, I think they're aiming to get to a more consistent set configuration, but they're achieving that through some customization in the interim. What we've been seeing is we see some of these large companies, I guess I won't name any in particular, but what they're doing is their reps are in the operating room, keeping track of what exactly is being touched by the surgeon, which trays are being opened, and ReadySet does that as a function of our technology. So that is I think an opportunity to inform the discussion, and particularly to see that a given surgeon has done this total knee 20 times. Every time there are 7 trays, but only 2 of those trays are opened in the operating room and the other 5 are not. That is the kind of intel, I think, that allows us to really customize in a way that takes away the extraneous. And the customization might not be that you actually remove the tray completely. It's that you might consign the tray so it doesn't have to be repeatedly sterilized over and over again and never opened at your own expense from the hospital's perspective.
That seems like another one of those soft cost savings that could potentially have maybe harder numbers wrapped around it, but not only a soft cost savings that's important to the hospital, but isn't that important for the vendor company that's supplying that to know as well? I mean, somebody's paying for the shipping costs, and that influences how they structure their pricing and everything else. Do you find that the vendor companies want to have access to this information and have a stake in the game as well, versus it just being a solution for the healthcare facility?
Yeah, absolutely. We actually view this as an end-to-end solution that has benefits for the hospital and the medical device company. And what we mean by that is exactly what you're alluding to, Justin, which is, can the device company extrapolate information from the data to determine how they configure their sets in the field? And to give you an example of how big of a problem this is, I know from personal research that 4 of the largest 5 orthopedic manufacturers had over $200 million in write-off of excess and obsolete inventory in the last year. And this is a yearly type of write-off that goes on. So what we're seeing is the device companies are very concerned with the turns on inventory and very concerned with the allocation of that inventory in a given geography. So by giving them greater information up front as to when the cases are, where the cases are, and allowing them to know even the items that are consigned on a shelf and haven't turned in 6 months at a given hospital, they have a much greater control over that field inventory. And, these write-offs are just unbelievable. Hundreds of millions of dollars a year are written off in this kind of inventory that may just be sitting on somebody's shelf unopened for God knows what reason. Maybe the rep just left the territory.
All right. So we're really talking about the impact of these technological innovations, and you kind of went right into it. There's like a logistics impact for both sides of the coin or both sides of the table in this conversation. But what about for revenue cycle? When we're talking about dollars and cents and we're really connecting, as you've described through this whole conversation, the billing and the care to the patient. Can you dive a little bit deeper into how these innovations and impact the revenue cycle?
Yeah, I'd love to. I mean, this is really a topic that's near and dear to my heart. And the reason I say that is revenue cycle is really where the rubber meets the road. And we know that although you can have many, many soft benefits that are clinically relevant and help the workflow, unless you have very hard, measurable kind of impact on this revenue cycle, chances are you're not going to be prioritized ahead of other healthcare IT implementations. But from our own customer base, we've actually taken and seen some data. Just for a little bit of background, ReadySet takes in vendor charge sheets. The vendor does not have to change their process. They just go ahead and upload their existing vendor charge sheet, and ReadySet will validate every line item against the contract to ensure that no products are being submitted that don't match your contract. And this is all automated for the staff. So what we've seen in that data that's come out of that is that we see about 42% of implants that are being requested on the front end are not on contract or they aren't preferred. We also have taken it further and looked at the actual implant charge sheets, and we have found that 38% of implant charge sheets have price discrepancies on them. And then when we drill down even further across our entire customer base, we are seeing about an 8% rate of products that are on contract, but the vendor is charging more for those items or it doesn't match the contract. An 8% rate. And if you look at the implantable device supply chain in the US, we're talking about close to a $60 billion supply chain annually. So if we're talking about 8% of those items having discrepant pricing on them, the time, the dollars, just all of the resources that go into correcting that are pretty stunning, really. So we see those numbers and it just tells us that there's a huge opportunity to ensure that everything that's being charged to your hospital and to your patient has been validated, that it's actually the right equipment that is on contract, that was needed for that patient anatomically, and that also meets the insurance kind of profile of that patient. And I don't mean to go too much further into this, but it's very common for implants to be upcharged 400 to 600%. So if you use an off-contract implant that is 30% more, the downstream impact to a patient is really mind-boggling. And that's something that we really have to think about when we talk about ensuring that implant bills are accurate, is who really pays here? It's the patient and insurance, and in some cases the hospital when they don't capture charges.
Keerthi, you just mentioned some awesome numbers and dollar figures, which is very impressive, because otherwise the hospital system and or the manufacturers, they couldn't really quantify any of that. So with that being said, you're offering value to both sides, obviously, but who pays for your solution and how does that work?
So in today's world, we believe that it's important for there to be a collaboration with the vendors. And we believe for that reason, they need to be able to use the technology at no charge. So today, vendors pay nothing for the ReadySet technology. They are mandated to use it by hospital systems that are seeking to gain the efficiencies that we can deliver on the hospital side. And as time goes on, as the vendor chooses to engage with ReadySet more and the hospital provides permission, there are greater levels of data that a given vendor can access that would allow them to be even more efficient and serve the hospital as efficiently as possible. So in today's world, the hospital pays for the solution and it's deployed. And what we are seeing, across a variety of ROI metrics is that there is many times over the cost is returned. An early study, we had a 5x ROI. That does not include the billing reconciliation piece that we recently just introduced, which is also delivering about a 4x ROI in and of itself. So those things absolutely kind of get the attention of the hospital. And I think that's why they've been so willing to actually pay for this technology, because they know that it allows them to be impartial. If a device manufacturer had paid for it or deployed it in their system, chances are it would be for the benefit of that device manufacturer. ReadySet is a truly agnostic system, and I think that's what really appeals to hospital systems.
So, Keerthi, is there anything else that you really think maybe we didn't talk about throughout this interview that is really important, or especially for our supply chain audience or strategic sourcing, materials management? I mean, maybe you even want to talk directly to that audience and say, this is what your life could be like with an effective technology.
Yeah, I mean, we love the opportunity to address this group. And I will say that truly what we believe is that in the past, supply chain leaders have really had to contend with physician preference and a variety of challenges as they negotiate agreements. And what I think has been a consistently lacking kind of tool in their tool belt has been an easy way to measure and compare vendor data, not only across their own system, but across other health systems, and also to look at it operationally. So we believe that with ReadySet, a supply chain leader now has at their fingertips the ability to really dive into data, get very granular about who's doing what in your health systems, and make some informed decisions about which vendor they want to deepen their relationships with.
Excellent, Keerthi. Well, once again, I've had the opportunity to interview you before, but you do a great job. And I think you also are very succinct and clear on your message and really what the value is here. And so I just want to thank you so much for coming on the early episodes of Power Supply.
Absolutely. I love this. This is fantastic, and well done.
Thank you so much. It's a real pleasure to meet with all of you.
And that was Keerthi Kanubaddi, CEO of ReadySet Surgical in Hayes. You and I actually both know Keerthi. I don't think we knew that the other one knew Keerthi so well, but I've known him for about 4 or 5 years. He's been doing some really excellent work with this vendor-managed inventory solution. And today's interview, I think, really talks about the ROI, which is really important because I can tell you, in talking with a lot of the materials managers, supply chain, sterile processing, there's some real benefits in terms of having access to information in a timely manner from the vendors to be able to receive those loaner consignment trays and really be prepared to take them in ahead of time, not last minute. And sometimes it's hard because it could be, an emergency case. So I think a technology can really help everybody mobilize quickly, but getting the funds committed, making that move, that sometimes can be a significant struggle. And now I think with all of the organizations, not just healthcare organizations, but also the vendor companies looking for ways to reduce waste in the system. Everyone is being challenged to reduce costs because of the stress that's been put on the healthcare system. And this is one of those places, I think, that the hard cost savings and the ROI for putting something like this in place it's really starting to come to fruition because of everything that he said, which is data.
Could not agree more. I mean, the last part of this whole podcast, he talked about, very specific data points and the ROI and charging too much for an implant or not enough or not knowing if you have the implants in house. All those things mean dollars. And so absolutely, ReadySet, I was impressed by what he had to say. I have known him for many years now, and I love the solution that he's brought to the table, and it's matured a bunch in the last couple of years. So absolutely, it's great to talk to him, and I think everybody's going to enjoy him for sure.
All right, that's going to do it for this week's show. As a reminder, you can support Power Supply by subscribing on iTunes, Stitcher, Google Podcasts, Spotify, iHeartRadio, your favorite podcast application. We'd certainly appreciate a rating and a review because your feedback is important to the show. And on behalf of Hayes, Gary, and myself, thank you for listening to this week's episode of Power Supply.